Hello and welcome to Pregnancy Info. Today we will discuss the importance of vitamin D during pregnancy. Vitamin D during pregnancy is important to help build your baby's bones and teeth. The amount of vitamin D that you need while pregnant is debated among experts, with some recommending 600 international units per day and others recommendations 1000 to 2000 IU per day. Ask your healthcare provider for guidance on how much vitamin D you need during pregnancy and whether to take supplement or not. Fatty fish, eggs contains vitamin D and some foods are fortified with it. Still, it can be hard to get enough of this important vitamin while you are pregnant. Why you need vitamin D during pregnancy? Your body needs vitamin D when you are pregnant to maintain proper levels of calcium and phosphorus, which help build your baby's bone and teeth. Vitamin D is also important for healthy eyesight and skin. Vitamin D deficiency is common during pregnancy. Inadequate vitamin D can lead to abnormal bone growth, fractures, or rickets in newborns. Some studies link vitamin D deficiency to a high risk of pregnancy complications such as gestational diabetes, preeclampsia, preterm birth, and low birth weight, but more research is needed to confirm these links. The symptom of a vitamin D deficiency can be subtle. They include achy muscles, weakness, bone pain, and softened bones, which may lead to fractures. How much vitamin D do pregnant women need? Vitamin D dosage is a topic of debate among experts, and recommendations amount for pregnant women range from 600 to 2000 international units per day. The Institute of Medicine currently recommends that the women under age 70, whether or not they are pregnant or breastfeeding, get 600 IU of vitamin D or 15 micrograms each day. But many experts believe that 600 IU isn't nearly enough. Some researchers have found that higher amounts closer to 1000 to 2000 IUs daily may provide greater benefits. Best foods with vitamin D during pregnancy. Fish liver oil, fatty fish, and eggs all contain vitamin D, but not many other foods contain it naturally. So a lot are fortified with vitamin D. To get more of this important vitamin, check labels. Some cheese, yogurts, and cereals are fortified, while others are not. Milk is a good source because all processed milk in the US is fortified. 1 tablespoon of cod liver oil contains 1360 IU or 34 mcg. 3-ounce cooked rainbow trout contains 654 IU or 16.2 mcg. 3 ounces cooked salmon contains 570 IU or 14.2 mcg. 8 ounces cereals fortified with 10% of the daily value for vitamin D, 80 IU or 2 mg. Do you need a vitamin D supplement during pregnancy? You may need to take a vitamin D supplement during pregnancy because most prenatal vitamins only contain 400 of vitamin D and it's difficult to get sufficient vitamin D from food alone, even when you choose fortified foods. What about getting vitamin D from the sun? Your skin uses the sun's rays to produce vitamin D, so most experts recommend doing some sunbathing, but exposure to the sun's ultraviolet rays intensifies pigment changes that can cause irregular skin darkening in pregnant women. Vitamin D deficiency in pregnant women. Factors that might put you at risk for a vitamin D deficiency include: number 1, obesity. Because body fat stores much of the vitamin D made in the skin, it's less available to the body. Darker skin. People with darker skin have a lot of melanin, which acts as the natural sunscreen and reduces production of vitamin D in the skin. Certain medications. Medications such as steroids, anti-seizure medicines, cholesterol-lowering drugs, and some diuretics reduce absorption of vitamin D from the intestine. Fat malabsorption conditions. Disorders such as celiac disease and Crohn's disease involve a reduced inability to absorb dietary fat, and that leads to less absorption of vitamin D. If you are worried about getting not enough vitamin D, ask your healthcare provider whether you should be tested for a deficiency or need to take a vitamin D supplement. When choosing a supplement, look for the kind labeled vitamin D3 or cholecalciferol, which is the most effective form. Vitamin D2 or erigocalciferol is about 25% less potent. So, this is all about the vitamin D, its importance, its deficiency, and all about it. So, share this video with the women who are suffering from the deficiency of vitamin D, and also subscribe our channel for such wonderful and helpful videos for you in future ahead. Thank you.